Welcome to your first set of notes for Unit 8, Clinical Psychology. These are your intro to mental disorders and the DSM-V. This set of notes is going to be looking at what mental disorder or mental illness looks like according to the DSM-V. So here's a quote of Mark, who is diagnosed with obsessive compulsive disorder. I felt the need to clean my room and spent 4 to 5 hours at it. I would take every book out of the bookcase, dust, and put it back. At the time, I loved doing it. Then I didn't want to do it anymore, but I couldn't stop. The clothes in my closet hung exactly 2 fingers apart. I make a ritual of touching the wall in my bedroom before I went out because something bad would happen if I didn't do it the right way. I had a constant anxiety about it as a kid, and it made me think for the first time that I might be nuts. So there's an abnormal connection. In his quote here, he makes this connection. He has an abnormal connection between touching the wall and something bad happening if he doesn't. So there's this abnormal connection, and that's what leads it to be a disorder. Here is some numbers you need to kind of just keep in your head as we go through this. So approximately 1 in 5 adults in the U.S. experience mental illness in a given year. So this would be all mental illnesses combined. And approximately 1 in 25 adults in the U.S. experience a serious mental illness in a given year that substantially interferes with or limits one or more major life activities. And many disorders, especially depression and schizophrenia, exist in all cultures of the world. So this unit is, yes, important for the AP exam, but even more than that, it is important for life because this is occurring in life. And so it's important to understand and develop empathy for individuals that are suffering from mental disorders. Why is it so important to define abnormal behavior? So really the question we're asking is, why is it so important to define abnormal behavior as disordered? Because haven't we all behaved abnormally? I mean, behaving abnormally means we're doing something that society is not accepting of, that it's outside the norms of acceptable society. And we've all done that. So what makes it the abnormal behavior disordered? Okay, and then who's to say when our behavior is abnormal enough to present a danger to others and therefore requiring detainment? When do we look and say this behavior that they're experiencing, they're exhibiting, is a cause for concern and we need to limit their civil liberties? That's what we're going to be looking at in here. When do we cross that threshold? So we need to define psychological disorders. So how do we define a psychological disorder? What makes it a disorder and not just abnormal behavior? You don't need to write these things down. We're going to do another slide at that, but I do want to spend some time kind of dissecting these things. So a behavioral or a psychological syndrome or pattern that occurs in an individual. So this is a repeating behavior that is occurring, that it reflects an underlying psychobiological dysfunction. So there is something happening, psychobiological. So there's, something going on in the mind and their perceptions of things. The consequences of this underlying dysfunction and this behavior that's leading to this dysfunction are clinically significant distress. So it's a painful symptom or disability, the impairment in one or more important areas of functioning. Key here is dysfunction and then distress. Okay, so you are having a consequence to this from this behavior. Now, this dysfunction and this distress must not be merely an expected response to common stressors and losses. So it can't be because you had a loved one die, you broke up with a significant other, you suffered a traumatic event. And it cannot be because of a culturally sanctioned response to a particular event. So trance states in a religious ritual. Those might be abnormal behaviors, but it's culturally accepted. So therefore, it's not going to be listed as a disorder. And then finally, primarily a result of social deviance or conflict with society. So deviant behavior, is not behavior that they are wanting to do, but it is behavior that is seen by society as not acceptable. But the person is not choosing to do it. I hope you understand that. So here, like when we look at whether or not we're going to define something as a disorder, we have to look at the dysfunction that is being presented, the distress, and then is it deviant. So this I do want you to write down, the 4 D's and a U. So deviant, you need to understand that it goes against the norm of a behavior. It may be abnormal in one culture, but normal in another. But if you're in the culture that views it as abnormal, then it will be seen as a deviant behavior. Distressful, cause the person or others distress. It disturbs them. It causes, issues. Dysfunctional. Are they causing dysfunction in a person's life? Alter their daily life? Are they struggling in school? Are they struggling in their family relationships? Can they get out of bed? And then dangerous. Does it lead to them causing harm to themselves or others? So if you have those 4 D's plus unjustifiable, it's not reasonable. Like there's no reason for Mark to touch the wall a certain number of times so that something bad doesn't happen later. Those things are not connected, and therefore it's unjustifiable. I do want to go back to distressful, because one thing I want to really make clear, because I feel like I didn't, this distress, it disturbs them, it's causing them turmoil in their life. Okay, so let's briefly talk about ADHD. Boys tend to have an uptick in hyperactivity. They just tend to be more hyperactive. So while ADHD is not a mental illness, it is a developmental occurrence. It can switch over to disorder. When does it do that? When does the behavior become a disorder? Well, you're going to look at, is it dysfunctional? Are they having problems in school? Are they having problems, with family relationships? Distressful. Is it causing the person turmoil? Are they, they're clearly going against the norms of behavior, so it's going to be deviant. But when does that click over? And that's when you're going to use the 4 D's and the U. Okay, so now let's talk about the history of psychological disorders. We actually have come a long way compared to where we started with the treatment of disorders. In ancient treatments of psychological disorders included trephination, which definition there on the screen, boring holes into the skull to remove the evil force, exorcism, being caged like animals, beaten, burned, castrated, mutilated, and transfused with animal's blood. So in ancient times, they viewed these mental disorders as a evil force, a demonic possession that needed to be removed. Medical perspective came about with mental illness with Philippe Pinel. He is from France, and he insisted that madness, mental illness, was not due to demonic possession, but an ailment of the mind. It's not something inside you, it is something in the mind that needs to be treated. So he helped develop the medical model, which is the health movement, where mental illness needs to be diagnosed on the basis of its symptoms and cured through therapy, which may include treatment in a psychiatric hospital. Now let's talk about the BioPsychoSocial Approach to mental illness. All 3 of these are going to interact on each other in its influence on the development of a mental disorder. So this approach assumes that biological, sociocultural, and psychological factors combine and interact to produce psychological disorders. So it's going to take the expectations and rules of a culture along with the stress of life and some sort of genetic issue to then lead to a mental disorder. You might want to pause the screen and zoom in so you can really get a good glimpse and understand what is under each one of these areas. Okay, now let's talk about perspectives on clinical psychology and just how they kind of relate. So let's start with the psychoanalytic. Believes that psychological disorders stem from unresolved childhood conflict. This is also the same kind of issue we saw in the development of personality. So the same individuals that believe that unresolved childhood conflict lead to your development of your personality. They also say it plays a role in the development of mental illness. So to a psychoanalytic perspective, to understand the roots of disorder, you must look at a person's early life history. What have they repressed and pushed into the unconscious that is causing issues in their life and causing it to manifest as a mental disorder? Behavioral, this is learning. Buzzword here is learning. So the beliefs that behaviors are learned responses. You're going to see a behaviorist involved in treating oftentimes anxiety, OCD, and phobias. So to understand the disorder according to the behavioral perspective is you must analyze how behavior has been learned and what reinforces the continuation of the behavior, and then work to change that reinforcement. So they aren't getting the same reinforcement, and therefore the mental disorder will be lessened. Cognitive, so buzzword thinking, this believes that cognitions, thoughts, and beliefs are the root of psychological problems. So what a person believes, and to a cognitive perspective, the only way to fix this behavior, this mental disorder, is to change those thoughts and beliefs, to change their belief on the issue. So the irrational, not correct thought process, we need to change that, and then the mental disorder will be lessened. And then your humanistic perspective believes that people are responsible for their own behavior, even their abnormal behavior. So you want to focus on the relationship between individual and society and how people view themselves in relation to others. You believe disordered individuals don't have self-worth, have conditions of worth placed upon them, etc. So in this case, it's about self-potential. What a person believes is their self-potential. And so if they have low conditions of worth placed upon them, then that's going to impact the abnormal behavior. And then our final perspective that we need to talk about is the sociocultural. This believes that abnormal behavior is shaped by family, society, and culture. So one relationship with others can support and even cause abnormal behaviors. The stresses that one encounters in life can influence the disorders that they have and don't have. We are talking situational component here because it's culture and family, the situation within the family, not necessarily genetics. Okay, now let's talk about classifying psychological disorders. So the most recent edition, the DSM-5, which was published starting in 2013, prescribes 400 psychological disorders compared to 60 in the 1950s. So the expanse of knowledge when it comes to mental illness and the classifications that we are diagnosing has greatly expanded. There are some that used to be diagnosed as mental illness that are no longer diagnosed as mental illness, such as homosexuality. The American Psychiatric Association rendered a diagnostic and statistical manual for mental disorders to describe psychological disorders. This is the DSM is how we know the criteria for a mental disorder. And so it is going to help doctors diagnose individuals with a disorder. So how is the DSM set up? There are 3 sections. The first one is the introduction to the book. This is just going to kind of give an overview of how to use the book, how it's set up. This will helps doctors, be able to use the criteria correctly in diagnosing patients. The second section is the diagnostic and criteria and codes. This lists the disorders. This lists the criteria that should be met, or a combination of criteria that should be met to be kind of diagnosed with the disorder. And then emerging measures and models. So how are we going to go about diagnosing the disorder? What assessments are we using? How are they being assessed? What measures are we using with those assessments? The goals of the DSM, there's a couple of goals. One is to describe the 400 disorders, give the criteria of what exactly is involved with each one of these disorders that are now being classified in the DSM, and indicate how prevalent the disorder is. So how how often you might see it within societies. Now, disorders outlined by the DSM-5 are reliable, thus diagnosis by different professionals are similar, because if you're using the DSM, you're going to get a reliable diagnosis every time, no matter what doctor you go to. It helps doctors be consistent and get similar treatments if a patient has to switch doctors. Others criticize the DSM-5 for putting any kind of behavior within the compass of psychiatry. This basically is going to, why are we trying to classify these disorders? Because that can be limiting and it can be abused. So and we see this abuse when we talk about labeling of psychological disorders. So critics of the DSM-5 argue that labels can stigmatize individuals by assigning arbitrary conditions and vague judgments. So sometimes it's like, oh, they have this one criteria for this one disorder, and then the doctor will be purposely looking for other factors so that they can diagnose them with that disorder and label them. And it may not be a correct label. Just because a person has one criteria does not mean that they meet all the other criteria and then get that label. Major research you should know about in this area is Rosehan's experiment on being sane in insane places. It's also known as the THUD experiment. I will link some more information on this below this lecture if you are interested in getting more information. But in this case, individuals went to various mental hospitals and walked in and told them that they were experiencing hearing the word thud in their mind. That was the only issue that they were claiming. And they got admitted into these mental hospitals. And some of these individuals, it took months to get themselves released from these mental hospitals. The only thing that they were telling was they were hearing the word thud, and they really weren't hearing it, but that's what they told them. Some of these individuals ended up on some, medications as well, very high potent medications in the long run. And so this comes back to that, they had one criteria, and now we're going to label them as schizophrenic or give them high dose medications. Another issue when it comes to labeling psychological disorders is the insanity label, and because it raises moral and ethical questions about how society should treat people who have disorders and have committed crimes. Ted Kaczynski here, he was the Unabomber. He sent mail bombs to universities and airports, U&A, and that's how he got his name. And when he was finally caught, he wanted to use the insanity plea, and he refused. But if he had used the insanity plea and been found guilty, his treatment would have been very different from just, than what he received because he did not accept the insanity plea. And then finally, on labeling psychological disorders, I do need you to understand that labels can be very helpful because they can help healthcare professionals communicate with one another and establishing the therapy. Various healthcare professionals that might be involved in treating an individual can all be on the same page because they have this label, which is a good thing. Now, understanding the categories that are seen in the DSM-5. They have spread out the categories. They've divided them up. Some of them originally anxiety, trauma and stressor related, and obsessive compulsive and related were all under anxiety label. They were subcategories. They've now split them out. But for this unit, as I talk about it in this class, I will talk about anxiety, trauma and stress related together, and obsessive compulsive together as well. That will be our next set of notes. So I do combine them to going forward, but just know in the DSM, they're all separate. Now, just to kind of loop back to the beginning on the prevalence of mental illness, you need to understand that 1% of adults in the U.S. live with schizophrenia, like 2% live with bipolar disorder. This is something that is prevalent in all cultures and in life. And so empathy for these situations is very much needed. This wraps up our first set of notes on clinical psychology in Unit 8. If you have any questions, let me know. And don't forget, don't do anything too stupid.